Good afternoon, everyone. Yeah, I'm Dr. Mohan from CanSport, and we're an NGO based in Delhi, caring for cancer patients for the last 20 years. And WHO has recently given us Public Health Champion Award, and we're helping our neighboring states to start palliative care. I chosen this issue because many of our cancer patients are in pain. Patients often tell us कि मैं मरने से नहीं डरता, ये दर्द मेरे से सहा नहीं जाता. So our doctor should be comfortable in prescribing oral morphine. This WHO pain letter was given to us by WHO about 23 years back. This talks about how pain should be managed, and use of morphine is in step 3 of this ladder. As and when we are managing pain, we not only manage pain with medications, there are certain other aspects to pain also. This concept of total pain was given by Dame Cicely Saunders, who talked about other dimensions of pain. When a patient loses a job, there's a lot of social pain. Your family position and family and social position changes. That also causes pain. The patient is angry with God. Why this happened to me? Why has God punished me by giving cancer? And issues like this. मैं तो मंदिर गुरुद्वारे जाने वाला हूँ, मेरे साथ ऐसा क्यों हुआ? एक बहुत बड़ी प्रॉब्लम है. There are other psychoanalysis when the treating cancer specialist says 10 लाख लगेंगे और आपका कैंसर ठीक हो जाएगा. When this doesn't happen, there is anger on treatment failure, anger on the medical fraternity. Somebody's breast has been removed and somebody's cheek has been, there's a surgery on the cheek, there's a disfigurement, people feel shame about it, and there's a constant fear in patients about pain, fear about pain and fear about death. And they are guilt feeling, had I gone to US, my cancer would have been cured. So as and when we manage pain, all these psychosocial, spiritual, and social issue needs to be addressed, not only medication. Step 3 ladder of WHO pain is strong opioids. In India, we have morphine and fentanyl, and methadone is on way to the clinicians, but commonly we use morphine and fentanyl. I want you to see this picture. This patient pain was not responding to tramadol. Patient said, "Kill me, shoot me, otherwise I'm going to jump from 4th floor of my house." When the patient was given a dose of morphine, oral morphine, and after 1 hour, he looked like this. And he told me, "Doctor साहब, मैं अपनी जान लेने वाला कौन होता हूँ? ये तो परमेश्वर के हाथ में है." If we manage pain effectively, we give control to patient. I remember one patient in West Delhi who was in severe pain. Her pain was not managed adequately. उसको हर हफ्ते, हर 10 दिन में खून चढ़ता था because family could afford it. When we started oral morphine, her pain became controlled. She took decisions. कि मुझे ये हर 10वें दिन खून नहीं चढ़वाना है because my doctor has told me I can't be cured. ये खून उन बच्चों के लिए इस्तेमाल है जिनकी रोड साइड एक्सीडेंट में जिनकी जान जा सकती है और ये खून उनकी जान बचा सकता है. मैं अपना प्रॉपर्टी का कुछ हिस्सा अपनी बेटियों को देना चाहती हूँ और मैं अपने उन बच्चों से मिलना चाहती हूँ जो 5 साल से विदेश में हैं. मैं अपने बच्चों को चाहती हूँ जो अमेरिका कनाडा में मेरे यहाँ आके मिले, और जो लड़का 10 साल से मेरे से नाराज है मैं चाहती हूँ मेरे से आके मिले. And she wanted to make some donation to Mandir and Gurdwara. And when she was pain free, She was pain-free for 2 months. Her pending work was finished. Her sons came from abroad, met her, and the exchange son also, there was a उनके साथ भी उनका relationship built up हो गया दोबारा से. And she died 2 months later, pain-free with all pending issues settled. So this is the importance of promptly and adequately managing pain by using morphine. During our medical training, we are taught this morphine is a dangerous drug. Morphine is a safe drug in safe hands. We have immediate release preparations in different strengths, 5, 10, 13, 60 milligram. The peak hour of the immediate release morphine is 1 hour. This means it can be repeated after 1 hour if the pain relief is not adequate. Of course, duration of this morphine is 3 to 4 hours in normal patient. Patients with hepatic renal function are normal. As and when we start morphine, we need to educate patients and families. उनको बताना बहुत जरूरी है कि ये मेडिकेशन एडिक्शन कॉज नहीं करती है और ये दवाई डॉक्टर की राय से बंद करें और इसकी डोज मॉनिटरिंग भी डॉक्टर की राय से होनी चाहिए. शुरू में थोड़ी ड्राउजीनेस, गिडनेस, वॉमिटिंग हो सकती है, लेकिन ये एक हफ्ते में सिम्टम्स डिसअपीयर हो जाते हैं. This medication can cause constipation. This can be managed by medication prescribed by the doctor. This medication has to be taken regularly क्योंकि ये हर केमिस्ट के पास नहीं मिलती है. And this medication should not be given to anyone else because this is not legal. This should not be only read to the patient and the family. This must be explained in details and their questions should be welcomed. On every subsequent visit, the clinician or the nurse must recheck the patient and family understands what is being told about morphine. How to start oral morphine? If adequate dose of tramadol is not providing adequate relief, start with a small dose of morphine every 4 hourly, plain morphine, with rescue doses of the same dose 1 hourly, provided hepatic and renal function are normal. For initial titration, we must use immediate release medication, and we must remember morphine is gold standard in management of moderate to severe cancer pain. When the patient is on plain morphine, it must be repeated 4 hourly. But for the matter of convenience, a night dose at 10 p.m. you can give a double dose so that patient has not to wake up at 2 a.m. and disturb sleep. If the pain relief is not adequate, then rescue doses can be repeated after 1 hour if hepatic and renal function are normal. So morphine is a safe drug in safe hands. We must be cautious when we are revising upward revision of morphine dose. First, check compliance and do a tablet count also, because just to ensure that patient has taken the morphine the way it has been prescribed and dose has been taken as per the medical advice. Supposing the patient has taken 10 milligram 4 hourly and 3 rescue doses for the breakthrough pain, this means patient has consumed 90 milligram 24 hours. Divide 90 milligram by 6, so revised dose is 15 milligram plain morphine 4 hourly and rescue dose of 15 milligram 1 hourly SOS. Monitor carefully drug intake and side effects. If the patient is controlled with plain morphine, patient could be changed to sustained release preparation, which is to be taken 12 hourly. For example, in this patient will need 45 milligram twice a day, and rescue dose has to be plain morphine. So prescription for this patient will be 45 milligram sustained preparation 12 hourly apart, or if the pain in between the pain is there, the patient should be given 15 milligram of rescue dose of plain morphine. We need to maintain this balance between pain control and side effects. It comes with practice, and every clinician should have zero tolerance to pain, so that patients, when the pain is adequately and promptly relieved, it gives not only comfort to patient, it gives comfort to caregivers and even to the caring team. So it's very important for us to be very friendly with morphine, so that patients' distress could be reduced. Every drug has side effects, so oral morphine is no concern, is also has certain side effects, but they are manageable. Drowsiness is again a temporary side effects. Vomiting is also is a temporary side effect, and drug of choice for vomiting is haloperidol, and in some cases perinom can also be given. Metoclopramide could be a second option. Itching is another rare complication. Constipation is a regular side effect of oral morphine. A doctor who prescribes oral morphine should also prescribe laxative with it. And there's no addiction. Respiratory depression doesn't occur with oral morphine. Constipation is a constant side effect of oral morphine. They say hand which prescribes oral morphine should prescribe laxative. One should be a stool softener, other should be a stimulant laxative. A decreased intestinal secretion cause dry stools, and constipation should be adequately treated. If constipation is ignored, then the discomfort due to constipation matches discomfort due to pain. I want to share an example where one of my patients who was a senior bank officer, pain was relieved, but constipation was ignored by the treating team. He was so upset, he told, tear my buttocks and take my stool out. So it could be a doctor-induced disease. So prescription constipation is also managed on a war footing. As and when inquiring about pain and the patient is on morphine, we must inquire when did you pass motion, so that it could be managed well in time. So I already told you, hand which prescribes opiates should prescribe laxatives. Dose varies. Some patients will need majority of the patient would need the laxatives, and there are various options. During our undergraduate days, we are taught about morphine causing respiratory depression. It doesn't happen in practice because when we're managing pain, cancer pain, pain is antagonist of respiratory depression. That is why respiratory depression doesn't occur. Respiratory depression can occur when the prescriber is careless, excessive doses are given after pain relief, adequate doses are given too frequently, there is sudden deterioration in liver and renal function, or some intervention has been done which has limited pain suddenly, or the wrong dose titration. If the clinicians are careful, mild dose reduction will help the overdosage, but is in the accidental overdoses, then patient needs admission and naloxone and supporting treatment would be required. So morphine is a safe drug in safe hands. Drowsiness is a common side effects of morphine, which usually happens in the beginning. Patient will be having drowsiness, confusion. Maybe because the patient has not slept because of pain for last many days. This could be because of this. But this drowsiness becomes all right without any medication in 3 to 5 days time. If it persists, then we must rule out CNS and metabolic reasons. Reduce the dose, decrease the frequency of morphine. This problem will not be there. If your patient is very elderly, your patient is very lean and thin, underweight, or the patient is dehydrated, one has to be cautious about the dose of oral morphine. There are certain myths about morphine which are not only prevalent among the general public but among the doctors also. They say morphine should be used only when the patient is dying. This is incorrect. I have a patient who's on 250 milligram morphine 4 hourly. He travels in government transport, attends court cases. Morphine doesn't hasten death. Of course, we had discussed that it doesn't cause aspiration if it is given with due care. Morphine does cause constipation, but this can be managed with medication. There is no fear of any dependence or addiction to morphine. I can be contacted on this email ID for any queries, and you can know about CAN support on this website. Thanks for your attention. Any question I would love to answer. Thank you, Akansha.
Let's take the questions.
All right.
First question is from Suresh. Talk about double effect. Scares me. Does morphine always shorten a person's life?
No, it doesn't. In fact, it improves the quality of life. As and when morphine is prescribed in adequate dose, which will going to promptly and adequately manage pain, it is going to improve the quality of life of not only patient but the caregivers also. So this message should not go to anyone that it shortens life. It doesn't. It does not.
Next question is from Prerna.
Yes, please.
Yes, sir. Please continue.
Yeah, please you go on, Akansha.
Next question is from Prerna. Which pains do not respond to morphine?
Yeah, it's a very good question. Some pains don't respond to morphine. Drugs like bone pain will not 100% respond to morphine. Spasmodic pains will not. Even neuropathic pains, because of nerves, will not also respond to morphine. But they do have some effect. So you need to add certain drugs to them so that those pains could be managed also. All pains don't respond to morphine.
Next question is from Praveen. How does your NGO, Can Support, help a patient with cancer?
Can Support has 25 home care teams operating in Delhi and NCR. Each team has a doctor, nurse, and a counselor on board who have been trained in palliative care. Our doctors are trained in palliative care for a minimum of a month. So are the nurses, and counselors are trained for 3 months before they are allowed to see patients. We travel to patient homes and we provide this service free. Doctor will manage physical symptoms and pain and other symptoms. Nurses look after nursing issues, which could be care of tubes, care of wounds, bed sores, etc. And counselor will provide a psychosocial and spiritual support to patients and families. It's a teamwork, and we run 2 outpatient clinics also, one in East Delhi and another in South Delhi. So those 2 OPDs are also run, and we're helping people to start palliative care across Delhi NCR. We helped Sher Kashmir Institute of Medical Science in Kashmir to start palliative care in their hospital. We have helped the Regional Cancer Center Bikaner to start palliative care. We have helped Punjab government to start palliative care at Patiala. And recently we got a request from Punjab government to help them start palliative care in all 22 districts. And even Raipur Cancer Center, Regional Cancer Center, we helped them to start palliative care. Next
question. Next question is from Vishal. What is morphine used for?
Morphine is a drug for moderate to severe cancer pain management. It's a gold standard as per WHO. I would say if a doctor is managing cancer pain of moderate to severe degree without morphine, it's like a soldier is trying to fight war without ammunition.
Next question is from Sanket. Which adjuvants do you recommend for head and neck cancer pain, especially shooting pain post radiotherapy?
Such patient would need to add NSAIDs and corticosteroids. These adjuvants are required. Adjuvants are drugs which are added to the medication to improve their efficacy. They are on their own may not be painkillers, but they increase the efficacy of painkillers.
Next question is from Preeti.
Yeah.
What is the government doing towards palliative care?
Government has allocated a lot of money for palliative care, but it still has to work on the ground. Kerala is one state where is a part of their primary health center, but in North India is still those things are yet to be seen. Recently, Government of India has called experts to formulate a syllabus on palliative care, which I was also part of it. A small book will come, which will be good for a referral book for doctors and nurses. It will be a preliminary book for them, so that we have a long way to go. But message should go: if a patient is being treated for cancer, palliative care must be part of it. It is not an optional thing. It's not a part of transition from care to care. Palliative care must be blended into the fabric of cancer care.
Next question is from Dinesh.
Right.
Does morphine administered all of cancer, including mouth cancer?
Please repeat the question. Hello.
The question is, does morphine administered all of cancers, including mouth cancer?
Yeah, it's a drug. We are world capital of oral cancers. If there are no oral cancer in India, 40% of the cancer incidence will go down. Oral cancer, head and neck cancer are very painful, and morphine is often prescribed for oral cancer with other medications also.
Next question is from Keshav. How does morphine work for pediatric population?
Wonderful question. I may inform the viewers that children tolerate morphine better than adults do. They should not be treated as therapeutic orphans. And when, as per WHO ladder, morphine is indicated for children, it must be given. They should not be denied the benefit of oral morphine for pain. Pain decides morphine.
Next question is from Sanket. Is there any best solution for radiation-induced mucositis?
This one thing called magic mouthwash, which has antihistaminic, local anesthetics. They can be given for oral rinse. It helps people, helps patients.
Next
People call
question
it
is from,
magic mouthwash.
next
Yes,
question
please.
is from Harry.
All right.
When is the right time to start morphine if the person is suffering from a cancer?
As per WHO, pain decides. If the patient comes to already on steps, pain, we this morphine immediately. See, if we are looking after a patient who's on Delhi-Haryana border, and our team cannot go on it's a weekend, and patients on step 2 ladder painkillers, I would my colleagues will prefer doing some advanced care prescribing. They will leave a morphine strip or 2 strips with the patient, so that if the pain doesn't respond to step 2 ladder medication, doctor can always be called on phone and he or she can always prescribe oral morphine. It's the pain which decides.
Next question. Tell us about your associations with hospitals.
We are working very closely with All India Institute of Medical Sciences. Lot many referrals do come from there. And all cancer hospitals in Delhi and NCR no cancer support, including corporate hospitals. We particularly get referral from all hospitals.